Hey guys, we are back with a bang. So to give you more information on breast cancer related to all the myths and facts, here we have Dr. Deepak Jha with us. He's a surgical oncologist at Fortis Vasant Kunj. We welcome you, sir, for giving us your auspicious time. I hope the viewers will have a lot of information related to breast cancer and they will have more knowledge and right information to stay away from cancer and they can spread it further.
Thank you so much, Simple. Thank you for giving me this opportunity.
Pleasure, sir.
Because I think we fear the unknown. So the more we know about breast cancer, the less we are going to fear it, and our efforts will be so much better, and we'll be able to get better cure rates, and we'll be able to stay away from the stigma.
Right. Very well said, sir. So, sir, we can have some questions from our viewers who are regularly up with Cheers to Life Foundation, and we will talk about some of the myths and common myths and facts for the layman who doesn't know anything related to breast cancer. So, can physical activity reduce the risk of breast cancer?
Definitely. I think physical activity is very important to maintain a healthy lifestyle. If you're talking about prevention of breast cancer, physical activity, regular exercise, that is one of the main reasons that can both directly and indirectly make a difference.
Right.
If you are into a regular physical activities, you stay away from obesity, you stay away from high BMI, high body weight, and this all indirectly and directly can lead to multiple types of cancers, including breast cancer. So yes, definitely, if you can maintain a good regular physical activity, that will be very highly advisable.
Great. So you all have heard Dr. Deepak Jha. So kindly move your butt a little more than usual. Stay healthy. So can healthy diet also prevent cancer?
Definitely. I think there are a lot of components in our diet which are known to give rise to cancer. That includes your smoked meats, your red meats, alcohol. These all are things that directly can lead to cancer, and plus excess of refined sugar and all these kind of other unhealthy food can again lead to obesity, which is known to be a cause of breast cancer.
Right. So eat more healthy and more nutritious food. Include lots of vegetables and fruits in your diet. That will give you more antioxidants and that will minimize the risk of getting breast cancer. So sir, there is one very common question that has come from married women. So is taking contraceptive pills lead to breast cancer?
Well, 30-40 years back, the kind of pills that we had, they were very high on hormone content, and as a reason of that, there was, yes, at that time there was a higher incidence of cancer with that particular contraceptive pills, but no longer.
Okay.
The current contraceptive pills that we have are absolutely safe and they are not associated with breast cancer.
Right. So you can continue with your contraceptive pills without getting fear of getting cancer. So they are very safe. So when we talk about self-examination in breast cancer, especially for women and younger women, so how often they should do the self-examination and what is the right time to do it?
Breast self-examination is a very, very important tool. Because in India what happens is about 50 or 60% of the patients that present to us, that present in a very advanced stage.
Right.
So basically the disease is festering inside and they have absolutely no idea about it, and
Right.
by the time it really comes to their notice, it is already very big in size.
Right.
And hence we get bad cure rates and very difficult and long treatment periods.
Survival rate also
Exactly. Survival rate also goes down because of that.
And let me tell you, if the stage is advanced, the cost of the treatment also goes very high and the treatment is also very painful. It is very aggressive. So early detection is the key. So you should examine your breast regularly, time to time, but you should go and meet a gynecologist or a surgeon to learn the proper techniques of self-examination, because you may miss out on some techniques.
Exactly. So what we advise normally is that breast self-examination should be done once every month.
Right.
Roughly around 7 to 10 days after your periods have ended.
Right.
Okay. And there has to be a specific pattern which has to be followed in every self-examination. The pattern does not change. So
Right.
the best way for it would be a one-to-one interaction with either your oncologist or your gynecologist, who can show you the method,
Right.
and you can learn it from him or her in one-to-one interaction, and then you can follow the same method every
month.
time, once
Yeah.
every month.
Right. And if you feel any suspicious lump or something, don't stop yourself going to the doctor. You should get it checked in the one go, because every cancer, there is next question we'll put, that every lump, is every lump a cancerous lump or it is benign? So Dr. Deepak Jha will put some light on that part as well.
The good part is that every breast lump is not cancer. In fact, 9 out of 10 breast lumps are not cancer.
That's a huge number.
That is a big number.
Yeah.
So, if you have a breast lump, there is no need to fear that you landed cancer. But at the same time, if you have a breast lump, that also does not mean that you would ignore it by saying, okay, 9 out of 10 times it is not cancerous.
Yeah.
Okay? So, in case you have a breast lump that is a new finding, that is, you've just observed it. So, it is very important for you to consult your doctor so that relevant tests can be done to ascertain what kind of lump it is, whether it's a cancerous or a non-cancerous lump.
Right. So it can be cancer, but it can be as a benign lump as well.
It is more likely that it will not be cancerous,
Right.
but still have an opinion,
Right.
so that things can be settled.
Yeah, get it checked. Don't just keep it with you. Right. So, sir, what is mammograms? Like, we often talk about awareness of breast cancer, we hear this word mammograms. So can you put some light? What is mammograms exactly?
Mammogram is again one of our important tools that we have to create awareness regarding breast cancer and early detection of breast cancer.
Right.
Mammography is basically an X-ray of the breast, where just like you have a normal chest X-ray, similarly the breast is compressed in a machine, and that it takes an X-ray, and that X-ray is what we call as a mammogram. So it is done in multiple views, and the recommendation is that after 50 years you should get it done once every year.
Right.
Okay.
Right.
And the very common myth that we have regarding mammogram, that it's going to be very painful.
Right.
Okay. So again, the important point is that at what time you should go and get your mammography done. Okay. Because if the mammogram is done close to your periods, then the breasts are naturally tender at that time, and the patient is going to have much more discomfort while getting a mammography done.
Right.
And at the same time, the findings might be fallacious as well.
Right.
Similarly, if the age is less, for example, it's 26, 28 or 30 years old,
Yeah.
then at the same time, again, mammography findings will not be very conclusive, because the breasts are much dense.
Yeah.
Yeah. So at that time, then we say that, okay, we should go for an ultrasound.
Ultrasound.
But mammography as such is a very important tool.
Okay.
It has some discomfort, but it is not painful.
Right.
Okay.
Right. Right. So women who think that mammogram is painful, so they have got this clear picture that mammogram doesn't cause any pain, but it may cause a little discomfort. But before going to a mammogram, you should speak to your oncologist or gynecologist. What is the right stage? What is the right time to go for the mammogram? And what is the right age for it? So, sir, if we talk about like breast cancer, so what are the stages?
If I were to describe in a broad general term, you could expect that yes, clinically we have 4 stages of breast cancer.
Right.
Okay, but breast cancer initially starts as a lump in the breast, a cluster of cells. Then from there onward, it goes to the nodes in the armpit area,
Right.
okay, which we call as lymph nodes
Yes.
in the armpit area.
Yeah.
And then from there onwards, it has the propensity that it can spread on to the other parts of the body.
Right. To the
Okay.
other organs
To
and
other
the
organs,
tissues.
for example, lung. And so our whole attempt is that we should be able to pick up the cancer when either it is only in the breast,
Right.
or it has maybe gone over to the lymph nodes.
Yeah.
Okay. Because these are the till this stage we have treatment and we have cure rates, and then these patients can be cured of the disease.
Yeah, they can be 100%
They
cured.
can be cured of the
Yes,
disease.
and the survival rate is very high, and the quality of life is very
It's
good.
good.
Yeah, once it has spread out of your lymph nodes, if it has spread it to your liver or lungs, then the treatment will also be very aggressive, and the survival rate would be much more lower. Yeah. So, sir, if we talk about a prevention, can eating certain types of foods increase the risk of getting breast cancer?
Like we've already discussed, like smoked meats,
Yeah.
alcohol content,
Yes.
red meat,
Yes.
these all have higher propensity of cancer,
Right.
number one.
Yeah.
Second is the kind of eating styles that we have now have become a part of our life, where we have very high foods that with empty calories, we have very high junk foods, fast foods.
Yeah,
So,
all processed.
yes, and the incidence of obesity and high body weight that we are seeing. So this definitely is a cause factor for breast cancer.
Right.
So we have to adopt a healthy lifestyle, which includes changes in our eating pattern, which includes changes in our physical activity,
Yes.
and these can prevent breast cancer.
Right. So I would request you all to stay away from red meat, processed foods, and empty calories food. You should focus on the real food, that is highly nutritious food, and do some exercises to minimize the risk. So sir, if we talk about the family history, can family history put the other people in the family at risk of getting breast cancer or no?
This is also a very important question. We must understand that 90% of breast cancer are not genetic, that is, they do not run in the family.
Mm-hmm.
So it is not a certainty that if your mother or elder sister or somebody has had a breast cancer,
Mm-hmm.
that would mean that you would also have breast cancer.
Right.
Okay. So that is the first thing that we must know. That
Okay.
90% of breast cancers are not familiar, they are not passed on.
Right.
But yes, if you have a first degree relative, for example, a mother or a sister with a history of breast cancer,
Right.
then again it puts you at a slighter higher risk than somebody
Than
who's
the normal individual.
doesn't have any
Yeah.
history of
History.
breast cancer.
Yeah.
A second part to that is that if we there is definitely this 10% of patients in
Mm-hmm.
which do have those genetic changes that can pass on.
Right.
But then that also we take a detailed history of the patients, what age did the breast cancer happen, what is the type of breast cancer that she had, and
Right.
then we see whether there is a chance or not that it can be genetic. So
Right.
90% of times, if a family member has had a breast cancer, that does not mean that you would also have it.
Okay. So things work in combination in this part. You have to be little calculative about the family history and other things. Then we can work out that oncologist can work out whether you are at risk or whether you are not. And then there can be some genetics test and all that can give you a clear picture whether the cancer genes are in your blood or no.
In fact, talking about cancer genes,
Yeah.
even if there is a person who has that gene,
Right.
okay, and then we are talking about her daughter, for
Right.
example. So
She may not
she
have.
also has only 50% chance of
Yes.
getting that gene,
Yes.
right? So even if you are, if
your
you
mother-
know that your mother had a genetic type of cancer,
Yeah.
even then there is a chance that you will not get
Be
that
carrying
gene.
the same gene with you. So that's a good thing.
Yeah.
Right. So does breast enhancement, what we talk about, people go for augmentation and cosmetic surgeries and all that, that also increases the risk of getting breast cancer?
Absolutely no.
Okay.
Absolutely no. There is no evidence so far that the breast augmentation procedures
Right.
that we do lead to cancer.
Breast cancer.
Similarly, I think there is another myth that is associated with cancer is that if you try and if you already have breast cancer and you go for surgery.
Right.
So the older surgery was where you would just go and do a mastectomy, the whole breast removal
Right.
surgery,
Right.
which is still very common. I mean, that is the
Right.
first thing that comes on, that let's remove it all.
Remove it all.
Okay.
Yeah.
But if you want to save your breast,
Mm-hmm.
or if you've got the breast removed and in the same surgery you want to get it reconstructed back,
Right.
so that also does not mean that you will have a higher chance of a recurrence in the future.
Right.
So because that is a very common myth or hindrance in our mind in either getting the breast conserved or getting a breast reconstructed.
Right.
A very important fact that we must all know is that we are achieving a very, very good cure rates in breast cancer. So it is not as if you have the breast cancer, everything is gone.
Right.
We are looking at 10 years down the line, 5 years down the line. So right now you are scared because you have cancer.
Right.
The word itself just puts so much fear in mind.
Yes.
So right now, all you want to do is get rid of everything. Okay, get my treatment complete and go ahead.
Right.
But 2 years down the line, 3 years down the line, when you are completely cured and cancer free,
right,
at that time you might feel it.
Right.
Okay. So take the decision while thinking through.
Right. So you all women who are unhappy with their breast size can go for breast augmentation at any stage. Just you need to consult your plastic surgeon or cosmetologist, and you can have, beauty boobs, I would say that, and you can wear a nice bikini and show off. So jokes apart, we come to a very sensitive issue back. So does breastfeeding reduce the risk of getting breast cancer?
Definitely.
Oh, that's good.
Yes. I think this is one of those points that is there in Indian culture, which is probably the benefits of us is not that widely known in our culture itself.
Right.
Okay. So breastfeeding is associated with a decreased risk in breast cancer. Breastfeeding leads to a terminal differentiation, that is slightly scientific. So it leads to certain changes that take place in the breast, and they are known to reduce the risk of breast cancer. It is not as if you have breastfed that there is no chance that you can have cancer, but again it decreases your chance of getting cancer.
Right. So breast milk is not only good for the babies, but it can also, if you go for a longer time of breastfeeding, it can also help to decrease the risk of getting breast cancer. So, sir, is only women get breast cancer, or men can also get it?
Men can also get breast cancer. Men comprise a very small percentage, probably less than 1% of patients that suffer from breast cancer are men. But importantly, very importantly, men can also have breast cancer. And in case a male person is having breast cancer, so because the breasts are not very well formed in males, okay, so the chances of the tumor appearing in a much higher stage, for example, involvement of skin, is even more. And then again, there's increased chances of having a genetic component to that cancer. So even males, if they have a lump in the breast, in the nipple area or the chest, that also should not be ignored.
Right. So all men out there, you should also examine your breast regularly. In case you feel any kind of lump, please go and get it checked. Don't feel ashamed about it. There is nothing to be ashamed of it. Because in India, cancer is still considered as a taboo. People think it's a taboo, but it is not. It is just a disease, just like your diabetes and high blood pressure or a cardiac disease. It is not a taboo.
In fact, cancer can be cured.
Yes, of course.
But diabetes, hypertension,
it's
are going to last your entire life.
It's a lifelong. You have to take the medicines lifelong, throughout your life.
So if you're aware about cancer and detected early,
yes, of course.
After that treatment period, you can just get on with your normal life and forget that you ever had cancer.
Of course.
But that cannot be done with diabetes or hypertension.
Yes. Though it is a painful treatment, it's not easy. It actually, affects the family as well, because there is a lot of fear associated with cancer. But if we are here trying to empower you with the right knowledge that there is nothing to be feared about it. There is no point, and if in future as well, if you have any other further questions, you can contact us. So let's come to the next point. Like, we are talking about the taboo, that cancer is considered as a taboo. But many people also think that cancer is quite contagious. If somebody in the family has been diagnosed with cancer, then the family members feel that it is contagious. The little children should be away from the patient. So can you put little light on that part?
Yes, I think there are two situations or two questions that we get very common, as in nearly every second patient asks us this question. Cancer is not contagious. Breast cancer, definitely, if there is a patient of breast cancer in your family undergoing the treatment, that does not mean that the cancer can spread from that person to any other person. So cancer is definitely not contagious.
Right.
The second very important and very common question that we face is regarding a biopsy of the breast cancer.
Oh, yes.
There is so very often that patient comes to us with reservations against biopsy कि सर biopsy नहीं करानी, बायोप्सी करेंगे तो हमें पता है कि वो बढ़ जाता है या बहुत तेज़ी से फैलता है, बायोप्सी होगा तो हम ट्यूमर को छेड़ देंगे तो वो और तेज़ी से बढ़ेगा. These are absolutely wrong. Right. Biopsy or surgery of any kind will not lead to the spread of tumor. Right. In fact, biopsy is very important to make the diagnosis. In fact, that's the first step of knowing that yes, there is a tumor. And from there we take on treatment. So, it is not contagious. It is not going to spread from one person to the other person in her surroundings. Right. And biopsy and surgery are absolutely safe. It is not going to make your tumor spread.
Right. So, if we like breast cancer or any other cancer is not contagious, give lots and lots of love to the patient who is going through in the family. There is no need to be, staying away from the patients. They need your support in every possible way, whether it is moral, whether it is physical, whether it is psychological support. So, and we are also talking about the biopsy here. So we consider ki, doing the biopsy, if we prick a needle there, so it can spread it to other parts, but it is not the case. So I would request to all the people who have been diagnosed with cancer or in future, if in case, though I wish nobody should be diagnosed with cancer, all the investigations are very, very important before, starting with the treatment. A doctor only comes to a protocol when all the investigations have been done. So biopsy is also a very important part of the diagnosis and the investigation. So, and there is a lot of myth, or I would say a lot of perceptions going around antiperspirants and deos, because everybody sweats. So does antiperspirant, roll-on or the sprays, do they cause cancer?
There has been a lot of activity and research in this area because this is a very common doubt that people have. But then all the evidence and all the research that has taken place so far has shown that the chemicals or the products used, they do not lead to an increased incidence of breast cancer.
Right. Right. So it is still a little mystery around it, I would say. But we can opt for a natural, roll-ons, and we can just spray maybe rose water, because rose water is naturally and it has little aroma in it. So instead of going for chemical laden, so on a preventive note, I would suggest. And then, the researches are going on. Maybe one day we'll come to.
Or we can go back again to our Indian culture and start using ether.
Ether, yeah, ether is also there, yes. We can, easily get ether in the form of the sprays. These days it's available. Ether or rose water. But first thing is go natural. Stay natural. Less chemicals is a healthy body, is equal to a healthy body. And, it will decrease the risk of getting cancer. So, sir, like these days we are looking at a lot of young women who are diagnosed with breast cancer. As I have been also counseling a lot of younger women, if you talk about at the age of 25, 24, and they have been diagnosed with advanced breast cancer. It's not about, in stage 1 or stage 2, even at stage 3. So what do the younger women have to do during, their checkups, regular thing, so how they can minimize it or get it detected in an early stage?
So, unfortunately, as our lives are mirroring more of our Western counterparts,
right,
especially in our practice in the metro cities, we unfortunately are seeing a lot of breast cancer patients that are much younger. Patients are coming to us at 22 years, 25 years, right, 30 years, 35 years.
Right.
Well, some of these patients do have a genetic component, that is, they do have a very strong family history.
Right.
Okay. But most of these patients again are just sporadic cancer. There is no specific reason for that.
Right.
Probably apart from the environmental factors that we have.
Right.
So the only thing to do is again be aware, be regular in examination,
Right.
In case there is any lump
Right.
that you see, please take notice of that and
Right.
take an opinion from your oncologist or gynecologist or a breast surgeon, right? And do not ignore these lumps just because thinking that okay, breast cancer is a disease of the elderly, or if I'm not 50 or 60 only, that is the time where we have breast cancer.
Yeah.
So again, like I said in the beginning, though 9 out of 10 times these lumps are not going to be cancers, but for that 1 out of 10, please don't ignore it,
Right.
and take an opinion.
Right. So there is a question from our viewer, Miss Varsha. This question has come and it is saying, is there any vaccine against breast cancer? Can we have it something?
Right now, no.
Okay.
For cervical cancer, we do have a vaccine available because a virus is known to be a causative factor in that.
Right.
With breast cancer, not yet.
Okay.
But if we talk about prevention of breast cancer, then in patients who have a genetic component or who have those defective genes in terms of BRCA1 and BRCA2,
Right.
for them we do have preventive surgeries which can prevent cancer from developing itself. Like the best example and the most well-known example is obviously like in the case of Angelina Jolie,
yeah.
who was carrying that gene, and then for prevention of the tumor, that is even before it actually can develop, she went for those surgeries to prevent that cancer from developing.
Right. Right.
So sorry, no vaccine yet, but in case there's a genetic component, then we have preventive surgeries.
Right. Hope Varsha, you are satisfied with your answer by Dr. Jha. He has addressed you fully on that part. So, sir, one more question. Is cancer, like people say, it is incurable? You know, once they have it, cancer or any cancer, if we talk about not just breast cancer, any cancer, they say it's incurable. Now we are not going to survive.
No, definitely not. Apart from the stage where the tumor has already spread to different other organs, breast cancer is a curable disease. If you're talking about stage 1, that is the early breast cancer, we have cure rates approaching 85-90%. So it is only stage 4 where we're talking about incurable cancers. Cancer in early stage, and if it has not spread, is definitely curable. As the stage increases, yes, the chances of cure comes down, okay? But at any given stage, you have to feel positive about it.
Okay.
You cannot think about getting in a recurrence all the time, because at any given stage, majority of the patients will be cured of the disease.
Right.
Okay, so don't go into that negative frame of mind thinking that okay, I've had cancer once and now it is bound to come back.
Right.
Definitely not. Definitely not.
Right. Right. So cancer is curable. Please remember that. So, sir, there is one more question that sometimes people say, or women say, if there's some kind of an injury that has happened in their breast due to some unforeseen reasons. So does it lead to the lump, and then the lump leads to the breast cancer?
Yes, this is also a very common scenario that patients, especially if they are 50 or 55-year-old female, they're playing with their grandchildren, and then sometimes they have trauma or some injury.
Mm-hmm.
So they think that okay, that led to this lump, and that lump has turned cancerous.
Mm-hmm.
It's actually because, again, we do not indulge in breast self-examination, so that lump has been growing there for some time, and that injury or that trauma basically gets your attention to that lump.
Right.
And then you find that okay, there's a lump, and then when you seek opinion, you find out it's cancerous. So injury or trauma does not lead to cancer, but yes, it can take your notice towards that lump, which
that
has
existing
propensity of becoming cancer.
That existing lump.
Yeah.
Right. Right. So I would say it's a blessing in disguise. And even it goes for the younger women who are very active in sports or something. You know, if they get hit or something, if they are playing or fell down or something. So if they get some kind of swelling or inflammation due to some injury, so still they can go for a check as well. Don't just keep it with you. So there's another question from a viewer that has come. What is the right age to go for mammograms? This has come from Manmeet.
Manmeet, thanks for the question because that's a very, very valid question. If we go by the recommendations that are given, the correct age to go for an annual, that is once every year mammogram, is the age of about 50 years. From about 40 years, you can have a mammogram once every 2 years. Before the age of 40 or from 40 to 49, whether you should have it more frequently or not, that will depend upon a lot of other factors, like do you have any pre-existing breast lumps or has there been a family history. But as per the current recommendations, yes, annual mammography is suggested from the time of 50 years.
Right. So, you know, like 1,50,000 cases have been reported in India every year. 1,50,000 new cases are coming. And out of that 1,50,000, there are 70,000 deaths that happens every year in India. So the survival rate, like most of them, this number is quite high, but most of them, they are coming, 50 to 60% of the patients are coming in the advanced stages. So that is why the number is huge, death rate is huge. But we can bring it down with the early detection. That is the reason we are doing this live video, to empower you, to guide you on early detection and myths and facts related to breast cancer. And sir, what is the survival rate? Like often patient comes and they ask about, like once they are diagnosed as well, they say, what is the survival rate? How long will I survive?
Survival rate again depends upon your stage. So that is why we want to impress this fact that if we are able to detect cancer early in stage 1 or stage 2, we are talking about 80 to 90% cure rates.
Right.
That means that in 80 or 90% of the females, the disease will not come back. Okay, so that is a very, very, very good cure rates.
Right.
So that is why the whole stress should be upon picking up early, not to be fearful of the breast lump that okay it can turn cancer, so just ignore it.
Right.
Okay, so don't ignore it. In case there is any lump, report it as early as possible. Get it investigated.
Right.
Okay, and if we are able to do that, right now we have reached such a stage in our surgical refinements and our chemotherapy techniques that as of today, most of the times we can either save your breast or we can have the breast reconstructed in the same surgery itself.
Right.
So your body image, because the breast is a very important part of your body image, so that body image is not going to get distorted by any means. So the way you go inside for a surgery, you will come the same way out with your breast but without the tumor. So don't be fearful of the fact that okay there might be cancer. Okay. There are very good cure rates and very good treatment modalities now available with us.
Yeah, and that with the minimal side effects.
With minimal side
effects, and it can also enhance the quality of life at the same time. Right. So do you think that cancer comes with a reason? There has to be some particular reason, because often patient says, मैंने तो ये नहीं किया, मैंने तो कभी ये नहीं किया, मुझे क्यों हो गया, मैंने तो इतने साल से योगा भी किया है, why cancer has come to me?
Yes, that is a very pertinent question, and that is a question that unfortunately we do not have answer for, because in most of the times, in 90% of the times where there is no familiar factor involved, there is no specific reason for breast cancer. Okay, so if you are maintaining a healthy lifestyle, if you are maintaining a regular exercise, if you are eating healthy, then will it absolutely ensure that you will not have cancer? Well, probably no. But then still, it is really, really going to decrease the chances of you having a cancer. So maintain a healthy lifestyle. Okay, there is not necessary that there has to be a reason why you develop breast cancer. Okay. So, but yes, still maintain a healthy lifestyle to keep their chances as less as possible. Do not add to any. Do not give a reason to breast cancer for it to develop.
Right. So, sir, if I ask you to, if you can give a message to people who are, like breast cancer survivors, so what will be the guidelines? What will be the things they need to follow as a regular follow-ups, or how to look after themselves and their family? Can they lead a normal, healthy life post-cancer treatment?
They can lead an absolutely normal life the way they were before getting themselves treated for breast cancer.
Right.
There are very simple minor changes in lifestyles that we say, but that also depends upon the kind of surgery or the kind of chemotherapy or the kind of radiation that
Right.
they've had.
Right.
Most of the patients, we expect them to be back to their healthy, normal lifestyles.
Right.
In fact, a lot of our patients are back to their normal routine while they are doing
Undergoing
their
the
therapy
treatment, yeah,
as
while
well.
undergoing the treatment.
Yes.
They continue with their
Yes.
professional life and the personal life.
Yes. And obviously your oncologist is going to give you a proper guidelines as to how frequently you are supposed to come back and report
Right.
and have an examination,
Right.
which is generally every 2 to 3 months in the first 2 years.
Right.
Then we increase that to about 6 months for every 5 years, and then
Right.
probably once every annual. And in the meantime itself, we will keep on telling you as to how often you would need investigations depending upon your symptoms or your initial stage.
Right.
But yes, we expect that probably apart from those 2 or 3 days that we want from you in an year,
Right.
the rest of the year is completely all yours.
Yes, that's there. You can go for vacations, you can continue with your professional life, your work life, you can continue with your other things as well. You can spend good quality time with your children, with your family. So sir, any other message you would like to give to, healthy women that, they should be aware of their body and they shouldn't be in the fearful stage of hearing कि breast cancer, सुनने से ही breast cancer हो जाता है. People say नहीं हमें सुनना ही नहीं है, हमें इसके बारे में कोई talk नहीं करनी है या कुछ नहीं सुनना है.
Fearing the unknown or just ignoring something which is lurking in the back is not going to decrease your chances of you having a breast cancer.
Breast cancer, yes.
In fact, if you know about it, then probably you can pass on that information to somebody who really needs, probably in your surroundings, because there was a time when we would not know of somebody who's suffering from cancer.
Yeah.
But
yes.
unfortunately, in this time, most of us have somebody in our close circle who has undergone this ordeal of fighting with
Right.
cancer.
Right.
So if we have this information,
Yes.
we can pass it on and probably help a particular person or someone to take early treatment for that and probably save his life. So knowing is power.
Right.
If we know about it, we can do something about it. If we
Right.
don't know about it, if we ignore it, then probably we're just going to land up with the disease at a much advanced stage and much more difficult.
Right, right. So as Dr. Deepak Jha concludes that knowing is a power, hope this session of our live video has given you power and all the right information and the guidelines. So you shouldn't have to be fearful about breast cancer. You just have to lead a healthy, normal life and taking care of your breast health. So I would like to thank Dr. Deepak Jha from myself and from Cheers to Life team, and on behalf of the viewers, thank you so very much for giving your valuable time to Cheers to Life Foundation and for the others.
Thank you so much, Dimple, for giving me this opportunity to probably share. And even if it made a difference to even one
Yes.
single person, I think this is all worth it.
Right.
And I think you guys at Cheers to Life are doing an absolutely commendable job. I see you coming and meeting patients, cheering them up, giving them the valuable information from patient side. As a doctor, I can keep talking and I can talk about all these theory, but then the patient's perspective,
Right.
that is something that obviously has to come from your side or somebody who's gone through
Yeah, I
it all.
know.
So I think you're doing a fabulous job, and even if this thing has made a difference to one person, I think
It's worth
definitely
it.
worth it.
Yes, it's definitely worth it. So see you guys. Take care. Have a healthy lifestyle. We'll keep you posted on other things. Hope you enjoy this session with Dr. Deepak Jha. Thank you so very much. Stay blessed, stay cancer free, take care.
Thank you.
Thank you.